Joe.
Hello.
How you doing? Listen, there's something wrong with my car. I don't know what it is. It's just not running right. You know how it is with me and my car over there. Would you take a look at it for me, please? Yeah, good, thanks. I'll be back at 5. See ya.
Not a great way to treat your favorite mechanic. He's a mechanic, not a detective. Hello, I'm Maggie Linton. You know, doctors can face the same kinds of challenges when patients tell them, "I just hurt all over." Such general complaints may mean the doctor has to consider several options when looking for the cause, and maybe even run more tests than you need. If you can be more specific, it helps. Then there's the other extreme.
Hey, Tom, I'm having trouble getting my car started in the morning. I know what the problem is. It's the start. Would you mind calling around and seeing if you can find a good rebuilt one?
Have you tried checking the fluid levels in the battery?
It's not the battery. I know it's the starter. Look, I gotta go. Call you after lunch. Thanks.
If the customer's always right, what do they need us for?
Good question. Vague symptoms and self-diagnosis can make your mechanic's and your doctor's job more difficult. Appropriate dialogue between the customer and the mechanic, between patient and doctor, help the diagnosis. We're going to point out some signs and guideposts that will help us communicate more effectively with our doctors and remind us of our rights as patients.
Doctor's office, may I help you?
When you call for an appointment, make sure the reason for your visit is clear to the medical receptionist.
Okay.
It's
And how
that
long have you
person's
had
job to
Raj?
decide how much time you'll need with the doctor. That's why you're asked, what's wrong?
Have you seen a doctor about this before?
Let them know if you believe your condition is urgent and you need to be seen right away. Then, think about what you want to accomplish before you arrive at the doctor's office. Try to observe and document your own symptoms as you would your own child's, and be as specific as you can when describing them. Ask yourself a few questions that you think the doctor might ask. They may sound a lot like the ones your mechanic asked about your car.
What seems to be the problem? Where is it located? When did it start? Is it constant? What makes it worse? Better? Are there any other symptoms with it?
If you're worried that your condition is serious, tell your doctor up front what you're afraid it might be. Communicating your symptoms and your fears will help the doctor address all of your needs and perhaps ease your anxiety. It may be helpful to bring a list of questions so you don't forget what you want to ask. Being organized helps the doctor help you. It might be a good idea to think of your doctor's visit as a business appointment and not be offended if your physician isn't as friendly as you'd like. Your doctor's primary goal is to get you on the road to good health, and he or she is focused on your medical problem.
I address patients politely, and I address them on a level that's not one of a friendly level. I address them on a level that it's clear that I'm trying to get information and that I'm interested in the information they have to provide me.
Doctors are caring professionals, but don't add unexpected requests to your visit. Asking the doctor to squeeze in a physical when you came in for a sore throat puts stress on the doctor, adds time to the visit, and makes the waiting patients wait even longer. No wonder they call us patient. You should also avoid asking the doctor to bend the truth.
Your sinus infection isn't quite clear, but I think another 10 days will do it. So I'd like you to fill this and take every last pill.
Doctor, my wife has a prescription plan, and I don't. I'll be taking the medicine. It's just that if you could make it out in her name, it's real expensive. It would really help.
I'm sorry, I can't do that. I understand that this is an expensive medicine. Unfortunately, I think it's what you need. But patients often don't understand that if I were to write your prescription out in an incorrect name, that would be a falsification, and I could lose my medical license.
When a friend or relative isn't feeling well, sharing your prescription with them might seem like a good idea. But sharing medicines may be dangerous. A prescription drug that helps you can cause serious allergic and even fatal reactions in another. Calling their doctor is the best medicine. Avoid asking for a prescription without scheduling an exam. And unless you're actually ill, don't ask for a sick leave excuse, jury duty exemption, airline ticket, or insurance claim reimbursement. Doctors who fill out false medical reports may risk losing their medical license. It's a good patient practice not to put the doctor in a position of having to say no.
This happens all the time, and you are put in a very embarrassing situation that your friend or somebody asks you to write a prescription for you which you do not want to. And you really have to use all of your wisdom and tricks to tell them no, because it is illegal and it can cause problems.
Good news, everything came back negative.
Oh, that's wonderful news.
Okay, good. Now what I'd like to do is to continue to monitor the situation. I'd like to do some follow-up tests in about 90 days.
All right.
Okay, good. What I want
If
to
you
do is
don't
see the
have a
receptionist,
primary care
she'll set up a
physician,
date, tell you
someone
everything
who
about
knows
the
you, knows your medical history, and makes you feel comfortable,
Thank you.
it's worth spending the time and energy to find one. A family doctor or an internist can treat your medical needs and also recommend a specialist if needed. We often spend more time looking for a car than we do for a family doctor. So how do you find him or her? The same way this good consumer found her brand new car, a little shopping.
Do you know a good orthopedist? As a matter of fact, I do.
Talk to your friends, relatives, co-workers, or health professionals about their doctors. Another avenue to check is the phone book under Physicians and Surgeons Referral Service. This is a great service. They can also give you the names of doctors in your geographical area who are covered by your health insurance plan. Or you can call your health insurance plan yourself and get that information. And don't overlook your state medical board for physician information. Once you have the list, and before you decide on a doctor, call the office and ask the doctor or office manager these questions.
Is the doctor accepting new patients?
Is the doctor in my health insurance plan?
At what hospitals does the doctor have privileges?
Who takes care of the patients when the doctor's not there?
Is the doctor certified in a specialty?
What fees and payment methods does the doctor accept?
If you're satisfied with the answers you get and the way you're treated, perhaps you found the doctor for you. If not, go to the next name on your list. As an educated and paying consumer, you have the right to choose or decline a physician's services. Once you've decided on a doctor, schedule a physical or a get-acquainted visit when you're not sick. This gives the doctor an unhurried opportunity to get to know you and get your medical history. When you arrive on time, don't forget to bring a list of all the medicines you're taking, prescription and non-prescription, and to mention any allergies you may have.
I've been following all your guidelines, lots of fruits and vegetables.
While the doctor and patient have different roles, a good doctor-patient relationship is based on mutual trust and respect. Such an atmosphere encourages the patient to open up to the doctor and allows a healing dialogue to begin.
Showing your respect for patients is absolutely key. After all, the patient is coming to you for help and assistance, and they're putting their trust in you, and you owe them the courtesy to respect their privacy, to respect their wishes, to explain things to them, and to treat them the best you can.
Here we are, Mrs. Ford. Here's a gown for you right here. Put this on for me, please. I'll be back in a few
Being addressed by your last name, having privacy and appropriate draping, having the doctor knock before entering an exam room, having a chaperone if you want one, having the doctor explain the what and why of an examination, and your being able to ask questions. These are all your rights as a patient. You also have the right to ask your doctor to stop an examination at any time if you are uncomfortable. And if you feel that you and your doctor are not a good match, you are free to end the relationship and seek your care elsewhere. This is a contractual type of service, and the doctor may also choose to end the relationship. If that happens, the doctor should notify the patient in writing. When it comes to maintaining a good doctor-patient relationship, an ounce of prevention is worth a pound of cure. While we depend on our doctors to help us, we also need to remember that they are human. If a misunderstanding arises between a doctor and patient, it's best to get it out in the open. A misunderstanding that goes unresolved helps neither patient nor doctor. It may be difficult to speak up, but you are your own best advocate. Voicing your concerns and questions will not only empower you, it will help the doctor to serve you better. There are times, for medical reasons, that a doctor may need to know intimate details of a patient's life. This privileged information, along with the doctor's knowledge of medicine, places the doctor in a position of power and the patient in a position of vulnerability or dependency. A caring doctor will never intentionally take advantage of that position or cross the boundary line of respect. If you feel that your physician has crossed the line by getting too personal in non-medical matters or by using flirtatious language or gestures, you should ask him or her to stop immediately. Comments or behaviors that can be interpreted as flirting or an invitation to a sexual relationship are in violation of the standards of the medical profession. Sexual misconduct includes not only sexual intercourse, but any inappropriate language or touching. Patients who have been subjected to sexual misconduct may hesitate to discuss it because of feelings of guilt or embarrassment. But these feelings should not stand in the way of ending the physician-patient relationship and filing a complaint with the medical board. By reporting inappropriate behavior, you are helping not only yourself, but other patients as well. If you have serious questions about your medical treatment, talking about it with someone may help.
How are you?
Well, I'm having a good week. I took my car in this morning, thought it was going to need major repairs. All it needed was a tune-up. And I had my yearly tune-up yesterday. The doctor says I'm doing fine. So, car and driver are okay, thanks.
That's good. I had a checkup a few weeks ago.
Oh, everything all right?
Let's talk about something else.
Why? Is something wrong?
No, nothing like that. I'm fine physically.
Oh, good. Well, then what is it? Did something happen?
I'm so uncomfortable during an exam.
Oh, I know what you mean. I used to be so timid around doctors. I didn't even ask any questions.
Me neither.
Not anymore, though. If I don't understand something, I ask. It's my body. In fact, my doctor's the one who told me to ask questions.
I'd like to ask my doctor a few questions. I was in the exam room getting undressed, and he just walked right in without even knocking.
You mean by accident?
No. First he didn't knock, then he stood there and he said, well, if we're going to examine you, you have to take all your clothes off. And he stayed and watched me while I finished getting undressed.
He did? Did you have a gown to put on?
No, and I was too embarrassed to ask for one.
So you're standing there naked?
Yeah.
That's awful. No wonder you're upset.
And that's not all. After the exam, he sat down and he held my hand and he said, well, you can relax now. He says, you're the picture of health. And then he took my hand and he put it on his leg right near his crotch.
What? Well, what did you do?
I pulled my hand away. I was so shocked I couldn't think of anything to say.
I guess not. Where was the nurse all this time?
I don't know, but she wasn't in the room.
What a jerk. Well, what are you going to do?
I'm not going back to him anymore, that is for sure.
That's good, but aren't you going to report him?
No, it's my word against his. I'd really rather not talk about it.
Yeah, I can see why you wouldn't want to, but he's probably doing the same thing to other patients as well, to some trusting and naive teenage girl.
It's so embarrassing, and the more I think about it, the angrier I get.
You should get angry, and you should report it.
The mission of the State Medical Board is to protect the health and welfare of citizens by ensuring that physicians provide high-quality medical care. The board is composed of licensed physicians and consumers like you and me, and has a staff of qualified investigators, analysts, and administrators. The medical board issues doctors' licenses, investigates complaints, and takes disciplinary action when needed. The board does not recommend physicians, but can tell you about their credentials, where they were trained, and whether or not any disciplinary action or public charges have been made against their medical license. The medical board looks to you, the patient, to notify them if there is a problem. Coming forward with your concerns helps the board to do its job. If you think your doctor has treated you in an unprofessional manner, billed you for services that were not performed, or lacks the skills to practice good medicine, the board wants to hear from you. You will be sent a complaint form, and the doctor may be required to respond to the state medical board. After an investigation, and in some cases hearings, the board will take action which can range from dismissal of the complaint to reprimand, probation, suspension, or revocation of the physician's license. Both the physician and the person filing the complaint will be notified of the decision. The state medical board can only discipline the physician and take action against the physician's medical license. The board cannot provide a refund or recompense to the consumer. That must be done in a civil court. Like the relationship between driver and mechanic, a good doctor-patient relationship is a partnership. For the doctor, it involves a willingness to listen not only to the patient's symptoms, but also to a patient's fears. For the patient, it means making the most of the doctor visit, noting symptoms, asking questions, being honest about your concerns, and letting the doctor do the diagnosing. A good doctor-patient relationship is an exchange of trust and respect, the benefits of which will outlast that brand new car and become even more valuable with time.